Hi, I'm Dr. Arul Furtado, a consultant cardiac surgeon at Aster CMI Hospitals, Bangalore. Today I'd like to talk to you about aortic valvular disease. So let's start with what the aortic valve is. The human heart has 4 valves and the aortic valve is one of them. The aortic valve regulates blood flow from the main pumping chamber of the heart called the left ventricle to the rest of the body via a blood vessel called the aorta. So in the certain portion of the population, this valve can either become narrow, by which we mean aortic stenosis, or it can start leaking, a condition called aortic regurgitation in medical terms. Now, a certain portion of the population, roughly about 1%, is born with a defect in the aortic valve. The normal aortic valve is made up of 3 leaflets, 3 parts. In these people, they have only 2 leaflets, something called a bicuspid aortic valve. Like I said, it affects about 1% of the population. And in a proportion of these people with bicuspid aortic valve, roughly about 40% or about 50% go throughout life without any problems. A small portion of these people with bicuspid aortic valve can either have a leak or a stenosis, like I mentioned. And when they have these symptoms, they come to us with either chest pain, dizziness, shortness of breath, easy fatiguability. So when we do an echo, we find a problem in the aortic valve, and at that juncture, the patient requires some sort of surgery to replace the valve, especially so when the patient is very young. There also exists an entity called senile calcific aortic stenosis, wherein as a part of the normal aging process, the valve leaflets get calcified and they become narrow. Now, this usually occurs in patients who are at least about 60 to 70 years of age, and in these patients there are various treatment options available. The gold standard has been valve replacement via cardiac surgery, but in a certain patient population who are high risk or who are unfit for regular cardiac surgery, these patients can be treated by a novel procedure called transcatheter aortic valve replacement. Now, transcatheter aortic valve replacement is recommended for those patients who are above 75 years of age, who have multiple comorbidities like bad lungs, who have had a previous cardiac surgery, or also those patients who have had a previous valve replacement and their surgical valve is failing. When it comes to open surgery, treatment options vary. We have conventional aortic valve replacement, but in our hospital at Aster CMI, we tend to offer what we call minimally invasive aortic valve replacement, wherein we replace the valve through a small cut in the upper part of the breastbone or on the side of the chest. With this minimally invasive aortic valve replacement, the blood loss is less, the return to work is faster, and the pain after surgery is much less. So this enables the patient to get back on their feet and go home much earlier. Again, if you have any queries or doubts about valvular disease, aortic valvular disease, or any other valvular disease, feel free to reach out to us at Aster CMI Hospital, Bangalore. Thank you.